Well, welcome everyone. We appreciate you joining us again today for this COVID-19 community briefing. My name is Marty Guthmiller and I'm the CEO at Orange City Area Health System. And this is the 7th edition of our daily briefing. So welcome again and here we go. I have this morning as a guest, you can see to my right, is Dan McCarty, Chief Operating Officer here at Orange City Area Health System, and Dan's going to talk to us today in a little bit about his role as incident commander and as the incident command structure that we have. Dan's been with us for 15 years, 17. I was close. I knew it was a couple of years beyond where we had been in this building, so appreciate Dan's leadership and invest in incident command, and we'll talk about that in a little bit more greater detail in just a moment. A couple things to start off with today. We learned yesterday that one of our own employees is going to be heading to New York for 3 weeks. Nicole Ployme, a nurse in our walk-in clinic and a nurse practitioner student, is heading to New York to help out the folks out there. And we're grateful that Nicole, first of all, is willing to do that. Secondly, we're grateful that her skill set can be utilized where it's needed out in New York. So kudos to her. Also should have another shout out to another local guy who's out there fighting the COVID-19 battle, and that's Matt Reisner. Matt is not one of our employees, but a local boy who's working in the Omaha area right now, and Matt's out there using his skill set as a physician assistant as well. So we're grateful for that. Our scoreboard for today, as we've been in the habit of reporting, is a total of 53 tests performed. We have still 3 positive, 48 negative, and 2 pending. So 53 total, 3 positive, 48 negative, and 2 pending. A little bit of history. We had our first COVID-19 meeting here at the health system on March 2nd. Incident command was formally initiated on March 11 with Dan McCarty in the lead. Dan's team includes Lori Gebauer from nursing, Dr. Al Laird that you've heard from before as Chief Medical Officer, Liza Scouten wearing a number of hats, certainly occupational health, PPE extraordinaire, emergency preparedness contact as well for Liza. Jeannie Jungers, infection control, and Steve Wahoff from the clinical services. So basically that's the team. This team has worked tirelessly over the last month now, and has worked very hard and has us well positioned for the future, as prepared as we all can be. And so here we are on April 15, and I thought it's an appropriate time to just give a shout out to Dan and the team for the work that they've been doing for this group. It is a tremendous group, and I wish you all could see the information that's being brought forward and the study that is happening at all levels at this time, as we all get bombarded with information. And so each member of a team can absorb a certain amount of information and then relay it to for the team. So thanks to you guys all for doing that. So Dan, did I miss anyone on your team, first of all? Did I describe their role incorrectly, or do you have anything to add?
No, I think you did a great job. One of the things I don't think we can do is start talking about heroes because it's overwhelming. Like Marty said, the team has just come together so well and worked so hard. That was one of the reasons I wasn't sure about participating today. I'm not really ready to get into all that, but yeah, appreciate the boss's comments and the support. And what you do when you go under an incident command structure, first of all, you have to make a decision, you have to make it fast. And so I remember distinctly that morning talking to Marty and I'm going, hey, I've been kind of training for this. And then Marty said something today I agree with. Marty hasn't done this before, Dan hasn't done this before, but it's gone exceedingly well. Of course, there's been challenges throughout the process, but right away you establish who your incident commander is, and then you got to start put your team together. So you typically put your operations as the next name that's used in the formal incident command structure. So I went with Jeannie Jungers at that point because she happens to be a person who's our infection control person. And she had a nursing background. So it was, okay, this person makes sense as let's use the term second. And then Dr. Laird is our chief medical officer. Brilliant decision there. He has excelled beyond any belief I ever had. He makes all of our clinical decisions, brings them to the team, and then the team has to weigh in on that. And then Lori Gebauer is a natural because she's in charge of patient care, the hospital floor, surgery, etc. Steve Walhoff has the clinic, another huge entity. One thing we kind of didn't have on the initial structure, but it was in the back of our minds, Marty is our senior care. So that's a whole nother piece of the organization. So when you look at the overall incident command structure, yes, senior care is there in Marty Guthmiller as the CEO. That made sense because senior care, Sharton Clay, is a direct report of Marty's on a day-to-day basis. So that was the initial structure. That was the reasoning. Liza was already mentioned, wore multiple hats, logistics liaison. Well, logistics is where she ended up being the PPE, personal protective equipment person, works with Dale Kuntz in the supply chain, and also logistics puts her to be the one in contact with the county with sharing of resources again. And everybody's just done a stellar job.
Great. So that's kind of how the structure works. Again, I think there's a kickoff meeting in the morning. There's an end of the day meeting and briefing. And depending on what's going on during that process, things happening during the day. So you've talked through that pretty well. Feel free to add anything as we go along. I'd like to talk a little bit about that. Okay, so that's been going on for the last week. It's kind of like the COVID virus today. It peaked, and now it's starting to go down in terms of the workload of IC. But what do you see lying ahead for incident command at this stage?
I do think the timing of today's talk is relevant because we just talked, as you know, yesterday. Monday, we're going to start talking about, we have to be so careful what terminology we use with this COVID crisis. Beginning to return to normal. And then in that also comes the natural transition from, in my opinion, your incident command structure starts to move back a little bit and your normal day-to-day operations of your organization comes back in and takes over. And again, we're new to that, but we're now starting to talk about, okay, this incident command heat is on. We're close to finishing, as Marty just said, the initial process of what would we do if something like this ever happened again. So now, how do we return to normal? And when you start to talk about how do we return to normal, when do you take your clinic, which currently has 2 separate entrances and 2 separate clinics, an acute and a well, at some point, you want to go back to normal. So we're going to start those discussions on Monday, as you know, because you're going to be a key part of those. When do you start doing surgeries that are not necessarily essential? That kind of stuff is where we will focus our efforts over the next couple to 4 weeks. I do think it's important to say we don't know when we're going to necessarily peak in Sioux County, but there's a definite feel, and much of the data points to things are going to continue to improve from here on out. Doesn't mean it couldn't change completely tomorrow. We are prepared for that.
And this is the point where we always knock on wood. We find wood somewhere because, we don't believe necessarily this is the eye of the storm, and the quiet on the Western Front, as I talked about yesterday, is because we're through this. We don't know that. The signs are pointing in that direction, but please remember it still could be the eye of the storm and the wave could still hit. It doesn't feel that way right now, but we want to make sure that people keep practicing the social distancing measures that we've all been, again, inundated with. But I tell you what, it really appears as though those are making a difference, that the projections in Iowa are way below where they were, and a lot of that is being attributed to the practicing of the various social measures. So Dan touched on what's around the corner for IC and kind of touched a little bit on what's around the corner for Orange City Area Health System, and we don't know, but we want to get back to doing business as normal as we can, as soon as many of you wish that you can all do that in your lives too. It's going to be a little while. and what that future looks like once we're fully matured in it, nobody really knows. We think telemedicine will clearly be more of a part of our daily lives than it has been in the past. And what else? We're not really sure. But we're going to get that back as soon as we possibly can. And even simple things like dress codes, in the health system, and meal costs and things like that. And I think little things that get us back to think, okay, this is normal again. But it'll be a long time. And I'm glad you mentioned the senior care aspect of that. Again, of all the things in all of this so far, one of the things that's impacted me personally the most is the psychological impact for our tenants and residents in senior care. And we need to keep those folks in our prayers. We need to keep that stuff out of Prairie Ridge, out of Landsmere Ridge, as much as possible. And again, we're so grateful for newer facilities that are structured with air handling and physically in such a way that, and obviously you're involved in that, with just the way we're positioned today, really as good as we could possibly be right now to protect the most vulnerable in our population. So we're very grateful for that.
I want to jump in on that too. And we had a community incident command meeting on Tuesday. A key message is what Marty just said, and that is, yes, social distancing, 6 foot, 10 people at a time is working. Yes, everybody's getting sick of it. Yes, people want to get out. Now is not the time to give up on that effort. It's working. Let's give it a couple more weeks, folks. Please be patient. I got an 88-year-old mom having a hard time. We're all going through it, but we need to stick together for a little bit longer here. You're starting to hear the governors, you're starting to hear the president say, hey, it may be time to start doing things, follow their lead. We followed CDC, Iowa Department of Public Health, the president and the governor through this whole journey. So please hang in there. It's important right now that we do our best to prevent this thing respiking. And I wanted to echo that strongly.
Great, thank you. So I took a sneak peek at the weather forecast this morning, and it looks like upper 50s, lower 60s for the next week or so. Sunny skies. So get outside,
Yes.
Exercise. We expect to have the best looking lawns in the planet right now. There's no excuse. So rake your leaves, tend to your tulips, which are through the ground, mow your lawn, fertilize your lawn, take care of yourself, exercise, eat properly, that kind of thing. Make sure you continue to be vigilant with mask wearing when it's appropriate, when you go out, wash your hands, that type of thing. But please enjoy yourself. So again, we just want to close today by saying that we've kept kind of out there is stay vigilant, stay strong, and stay well. Thank you again for joining us today.